All right. Good morning, everybody. Good morning, members of our committee and members of the public and those that are joining us online. Welcome to House Labor and Health and Social Services Committee. And it's Friday. Yeah. So Mr. Caldwell, if you would call the roll.
You'd like the roll?
Sure.
Representative Clouston. Here. Representative Guggenmoos. Representative Heft. Here. Representative McCann. Here. Representative Ottman.
Here.
Representative Stivar. Representative Wasserberger. Here. Representative Yen. Chairman Rodriguez-Williams.
All right, so committee, this morning is a little different. We will have a presentation, and again, thank you for being here. We have two guests that our good speaker has invited to present at our committee, and after their presentation, we'll have opportunity for you to ask questions of them. And mainly the purpose of the meeting is really just to gain information, hear perspectives as we head into the interim. And my hope is that, you know, we learn different things from different people. So without further ado, ladies, if you would please come forward. Sure, yep. You'll have to press the green button in order to be heard on the microphone and through the live Zoom feed as well. So if you would just say your name and introduce yourself, tell us a little bit about yourself, and whoever would like to go first, please. Go ahead.
Hi, can you hear me? There you go. No. Hi, I'm Sheila Matthews Gallo. I'm the founder of ablechild.org, and I'm here representing parents across the country, caregivers, and we're a 501(c)(3) organization, and we're funded by the American people. We take no federal or state grants.
I'm Amy Miller, and I am here. I have been doing legislative work for 11 years. Last year, I was a registered lobbyist. I was a co-director at Reform Pharma, which was a 2-year initiative that was founded by Robert Kennedy Jr. And I am here to speak, and I'm so excited that you guys want to make Wyoming healthy again. So I will be talking about our legislature. I've done the work in Tennessee, so give you more insight on that.
I've prepared some remarks, and, you know, I can start, if that's okay. I'm open for questions afterwards.
Sure, please do.
Okay. Chairman, I appreciate having the opportunity to address the House Labor, Health, and Social Service Committee in light of the recent tragedy that left the people of Wyoming heartbroken and desperate for answers for such a senseless loss. Again, my name is Sheila Matthews Gallo, and I am the founder of Able Child. Our mission is informed consent and the right to refuse psychiatric products and services. We represent hundreds of parents and caregivers across the United States. In our nearly 2 decades of advocacy for informed consent as it relates to psychiatric diagnosing and prescription psychiatric drugging, Able Child has unfortunately seen too many of these senseless murder-suicides and have not only reported on them, but tried to obtain information that may shed light on the possible causation between psychiatric drugs and violence. Tranielle Harshman recent actions aren't the first case of senseless, violent, deadly behavior on the part of someone experiencing mental health difficulties. While Abelchild is empathetic to the unbelievable pain Mrs. Harshman's family is experiencing, it is the information publicly provided by Mrs. Harshman's husband, Cliff, that Abelchild would like to address as an example of what information is an absolute necessity to make sense of this senseless tragedy. According to the interview conducted by the Cowboy State Daily, Harshman explained that his wife had been suffering from a number of alleged mental disorders, including depression, postpartum traumatic stress disorder, and postpartum depression, and explained that his wife had been prescribed many treatments over the years. Harshman reported they tried medication interwoven with holistic herbal and vitamin supplements in the mix, and finally said his wife tried Prozidin, a drug approved for the treatment of hypertension. In Mrs. Harshman's case, the drug was prescribed to treat her nightmares. Finally, Harshman said that his wife was taking ketamine in the days leading up to the murder-suicide. It is of interest that Friends actor Matthew Perry died as a result of illegal use of ketamine. Perhaps it is because of ketamine's legal status that Harshman told the Cowboy State Daily that he, quote, hesitated to discuss his wife's ketamine prescription publicly. It is with this statement that Abelchild must focus because it is the lack of investigative information that stifles any real understanding of these violent acts. Let me explain. To thoroughly understand what may have occurred that precipitated Mrs. Harshman's deadly, violent behavior, the specific mental health records must be examined. Harshman had already alluded to the fact that he believed that the cause of his wife's mental health issue was a chemical imbalance in your brain. Unfortunately, this is misinformation. Chemical imbalances has always been a theory, not science, and was thoroughly debunked in 2023. The medical profession has no medical scientific data to prove that there is any objectable abnormality that is depression. In other words, the psychopharmaceutical industry has no idea what causes depression. Nevertheless, it is imperative to know that Mrs. Harshman's specific diagnosis and what psychiatric drug medications were prescribed in the years and months leading up to the deadly attack. It is no secret that each of the prescription psychiatric medications that are FDA approved for treatment for depression carries significant adverse events, many of which include violent behavior. For example, all antidepressants carry a black box warning for suicidality, the most serious FDA warning available prior to pulling a drug from the market. In other words, the antidepressants that are prescribed to treat depression can cause suicide. More than that, there are other significant possible adverse events. Consider the following possible serious adverse events associated with 3 random psychiatric drugs: Zoloft, antidepressant; Trazodone, antidepressant; Seroquel, antipsychotic. Side effects include aggravated depression, aggressive reaction, aggression, agitation, anxiety, confusion, depersonalization, delusions, nightmares, mania, hallucinations, psychotic, paranoia, suicide ideation, and suicide attempt, to name a few. What is more, it is possible that Mrs. Harshman had been prescribed numerous psychiatric mind-altering drugs in which are referred to as drug cocktails, polypharmacy. The problem with psychiatric cocktails is that no clinical trials have been concluded or conducted on any drug cocktail, and many consider prescribing experimental and dangerous. There currently is a case in Massachusetts where mother Lindsay Clancy strangled her small 3 children and tried to commit suicide. The suicide failed, and she is being criminally prosecuted. Her attorney is fighting the criminal suit, stating she was out of her mind on 13 psychiatric drugs she had received 2 months prior to the murders. Recall that all the adverse drug reactions are possible for each of the drugs in the cocktail, and it should be of no surprise that these drug cocktails often produce violent outcomes. It is also necessary to consider Mrs. Harshman had been on any psychiatric drugs at the same time taking ketamine. It is important to note that ketamine is not approved for psychiatric use, and in 2023, the FDA put out a warning, a public warning about the risks associated with ketamine, including disassociation, disconnection between a person's thoughts, feelings, and sense of space, time, and self, problems with attention, learning, and memory, dreamlike states, hallucinations, sedation, and confusion, to name a few. Given that 1 in 4 American adults is prescribed at least one psychiatric drug, and that each of these drugs have possible violent behavior as a side effect, it is no longer acceptable to withhold important mental health data. Wyoming has a patient bill of rights relating to psychiatric treatment. Those laws currently abide by the World Health Organization's definition that do not include specific mention of suicides and whether the deceased had psychotropic medications in their system at the time of death. Able Child recommends that all autopsy data, including toxicology testing for all psychiatric medications. Further, Able Child recommends that the state implement instructions for prescribers to provide detailed information about the psychiatric drugs being prescribed, including all the possible adverse side effects. Explanation that polypharmacy prescriptions have not been clinically tested for efficacy or safety, and that all patients are provided an exit plan for safely weaning off the drug treatment with specific timeframes. We live in a world of great stress and difficult circumstances. Too often, mind-altering drugs are prescribed as the magic fix for coping. Unfortunately, a close look at the mental health of America reveals a nation in crisis. Every year, mental health spending and psychiatric drug prescriptions continue to increase. At some point, it becomes necessary to ask the tough question. With so much continued mental health intervention and enormous increases in spending, why isn't anyone getting better? Why is the nation in a mental health crisis? Able Child believes we will never answer that question without making specific mental health and prescription data available to the public for review. Thank you, Chairman and members of this committee. I'm happy to answer any questions you may have.
Thank you, Ms. Gallo. And you mentioned a tragedy that did occur here in our great state. And our hearts on behalf of this committee, I can tell you our hearts do go out to the Harshman family and those that are impacted by that tragedy. I'm hoping that you can share a little more about a concept that you mentioned. You talked a little bit about an exit plan. And when patients are weaning off or lowering dosage, I assume is where what you're talking about. Can you elaborate a little bit more about that?
Sure. With the polypharmacy, these drugs have never been tested on humans. So there's an interaction, and each one of them carries severe side effects of suicide and nightmares and hallucination, as I said. So when a patient appears in an ER or in any circumstances, that's the last thing that's looked at. In fact, when they appear in a hospital, they're often prescribed more psychiatric drugs. So we aren't even looking at what they're currently on and reporting it to the MedWatch. And as far as specifically weaning off of them, I could tell you from personal experience that it's very dangerous to go off these drugs without oversight. And blood work needs to be done. And you have to gradually step off these drugs, according to the psychiatrists that we've been working with over the years. So an exit plan has to be put in place, because prior to going on psychiatric drugs, informed consent requires you to give all the information. A lot of parents, I work with children, plus I've been working on these mass shootings across the country, these mass murders. People aren't told that they have to be on these drugs the rest of their lives. This is a pharma cradle to grave approach. And so I think that an exit plan would only be humane. And when somebody presents in a crisis of psychosis or suicidal ideation, that the drugs are looked at.
Thank you, Ms. Gallo. Committee questions for Ms. Gallo. Representative Wasserberger.
Thank you, Madam Chair. Thank you so much for coming in today. I'm real excited to hear what you guys are working on. And I'm just curious, as far as finding exit plans and things of that nature, are you folks familiar with any type of herbs or natural remedies to help people weaning off of these really strong medications?
Ms. Gallo or
I can half speak to that.
Ms. Miller.
I do know friends that have weaned off with the help of a physician, but I'm not a physician, so I can't speak exactly to that. But there are several people that have worked with alternative healthcare people who have had their lives changed. And one friend that I'm thinking of particularly just got off of her prescription medication and is now on a herbal supplement.
Committee, additional questions for Ms. Gallo. Representative McCann.
Thank you, Madam Chair. Are you familiar with the work of David Grossman? Colonel David Grossman wrote the
I'm
book
not.
on killing, on combat.
Ms. Gallo.
In the military, the psychiatric drug abuse in the military, or was it?
No, it was more, I don't really want to dive into that, but just, he's done a lot of good work on that. He works, you said the mass shootings, and he does a lot of work with that, so. But as far as the post-traumatic stress disorder, they are coming up with some good ideas. It might be something to consider as far as that goes, but very good books.
That's wonderful. Alternatives to psychiatric drugs and the informed consent part prior to getting on them is critical for public safety.
Additional questions? Vice Chair Ottman.
Thank you, Madam Chair, and Mrs. Gallo, right? Or the other one?
Sheila Matthews Gallo.
Okay, Matthews Gallo. Okay, thank you. This has been something, and I think I put it down for some interim topics because it's something that I really wonder about. I have two family members that both of them were prescribed these drugs, and both of them, it terrified them. They were having terrible nightmares, and it was worse than went on. But I didn't go into a lot of it. So what I'm wondering is this, like you would just go to your general doctor and say, you know, I'm just having problems sleeping, or I'm stressed out, or whatever, and then it's prescribed that easily? Or is it, you have to go to a counselor and go that way? If there's any information there. I've also talked to some law enforcement and said, okay, is there toxicology reports in terrible instances like this? And they said, oh, yeah. I'm like, well, where do the reports go? And that's kind of where it's ended. So if you could just talk on those things for a minute, I'd appreciate it.
Ms. Matthews Gallo.
So I have two sons, and how I got into this was my youngest son was told through the public school system that he had attention deficit disorder. I was never told that this was not a real medical diagnosis, that it was voted in by psychiatry. I never was given that information. So I could tell you that throughout the country, the school systems are identifying these children by checklists. And then they are sending them usually to vendors of the state throughout the country. And the vendors profit off of getting more and more of these children on psychiatric drugs. So that's how I got into it. And as far as your other question, what was that again? It was
Toxicology.
the toxicology. As working around the country on these mass killings, I worked for Sandy Hook. I was on the ground within a week of Sandy Hook, and I could tell you that all the medical records were sealed immediately. It took my organization a year to get the name of the psychiatrist, Dr. Paul Fox, who was criminally charged, that never made the media. Nicholas Cruz in the state of Florida, he was drugged as a foster care child, adopted, and was on a cocktail of the polypharma. And the combination of drugs left him at 18 going out and buying Xanax bars. And he's still alive, but and in jail the rest of his life. However, that information, as far as his mental health, was used in his sentencing hearing. But the psychiatrists in those cases were never held accountable. And the toxicologies are being withheld in the state of Tennessee, and Amy can certainly speak upon the legislation that we pushed last year there.
Okay, further questions? Representative Clouston.
Thank you, Madam Chair, and thank you, Ms. Matthews Gallo. Just two quick things. You mentioned Dr. Paul Fox was prosecuted. Can you tell us what he was prosecuted for?
Ms. Gallo.
Yes, he was actually having sex with his patient, and that's what Homeland Security arrested him on. But that was nothing to do with his treatment of Adam Lanza. And our organization was approached by other family members who had children that were damaged by this same doctor, and the state of Connecticut did not pursue anything our organization was trying to get at as far as accountability in that mass killing. So he was prosecuted on having sex with his patients.
Follow-up, Representative Clouston.
Thank you, Madam Chair. And then thank you again. So, you brought us a lot of information. What I guess we really want to hear is, what do you see as solutions?
Ms. Matthews Gallo.
I see toxicology becoming a vital part of these criminal investigations, that the treating psychiatrists need to be named. They were very brave on treating these people. Then they should come out and explain how their treatment went so wrong. So I see toxicology. Amy?
Ms. Miller.
Okay, sorry.
I would just like to add to that, I think asking very specific questions, because as you mentioned, Representative Hotman, you mentioned the toxicology reports, but what is it specifically with toxicology reports? Because they do toxicology, but they don't go far enough. So like our mass shooting in Tennessee, they did toxicology, but they didn't test for the therapeutic levels. So the questions that when you guys make the laws, that's where you can be very specific on what needs to take place so that they can't side skirt it. And that's what we're speaking to. We have a bill, the autopsy bill in Tennessee, and it will be heard in the next few weeks.
Thank you. I have a follow-up to Representative Clausen's question, and for either one of you. Great recommendation regarding the toxicology, but have either one of you have heard of psychological autopsy? It's basically when, if somebody dies by suicide with the family's consent, somebody that's certified in performing psychological autopsies basically goes around and interviews, takes statements from those that are involved in the decedent's life and collects that information. I think statewide, there's a lot of value in that, whether, it's a murder-suicide or just a suicide death alone, to collect that information when looking at mental health crises as well. I'm not sure if either one of you have heard of states adopting.
I have not heard that.
Thank you.
I have not heard of that. I'm a little weary of that, just because I feel like the same industry that potentially is involved in treating the patient could be involved in gathering the data. A suicide is a violent murder of oneself. It's a criminal act, so I would prefer to see it within the realm of the law, police, and an investigation of a murder crime scene.
Thank you, Madam Chair. So just curious, and you may or may not know, but I do not. So with our recent murder-suicide with the Harshman family that we referred to, what happens afterwards? Does the Board of Medicine investigate what medicines she was on, who prescribed those? Was that appropriate treatment? What's the process following such a tragedy?
Ms. Matthews-Miller, if you're not familiar with Wyoming's process, I guess if you could just touch on what this would look like in other places as well.
Well, I see that the police are in charge of the investigation. They go to the treating psychiatrist and get the medical records and the treatment records. And then they work closely with the DEA if need be, because it's controlled substances. So I would see it as a crime scene, and that as vital information as to the motive of the crime. So I see that. And then as far as reforms, the polypharmacy should be looked at through medical boards and through the hospitalization.
And I can speak to what the public heard, what happened after our mass shooting, and it was immediate transfer of the Tennessee American Academy of Pediatrics sent out a letter to the governor saying we need gun violence reform. And it's the gun, the gun, the gun. And the question is, what's making them pull the trigger? And if you are the American Academy of Pediatrics, it is your lane to figure out the prescriptions that the drugs that you are prescribing, do these have an effect? And that's one thing that I actually brought with me today is, this is the package insert. And one of the evidence pieces that we can even stem from that's very quick, warning, this is the black box warning right here. Warning, suicidality, and the list goes on, I don't need to read them, they're more than welcome to see that, but right there, that word says it, right there. So why are they not looking into it? Because they are sponsored and bought off by big pharma companies.
Ms. Miller, let's pause and let's hear your testimony now, and then we'll go
okay.
back to questions.
Okay.
Yeah.
So one of the things that I want to bring to your attention is, one, this black box warning. If we're looking the other way, why are we looking the other way when we have evidence right here that we should be investigating these? One of the things that going back to that letter, there was a lot in the legislature that happened where people were rising up, they had protesters, all different things, while our legislature was pushing for more money in the mental health industry. And I kept asking the question and kept asking the question, why are the drugs not being looked at? Why? People didn't want to talk about it. People don't want to go up against the industry. And quite frankly, they don't want to be accountable. And that's what I'm here to really dive into with you guys today. You have the power to get answers, to get the data. Do you guys have state data for suicide? Is that state data under suicide? Is there a subcategory that says of the suicides, this many were on these drugs? Get that data, whether it be, you asking your committee or whether it be making a law. I mean, you don't want to go make laws just because, but what needs to happen here? Because putting more money and putting more money towards mental health without the accountability, that's failing the public. And it's time, we cannot fail the public anymore. We're all hurting. We all have been affected by this. My kid is growing up knowing all these friends are on these drugs. What happens? Why? Why is everybody labeled? Why does everybody feel that they have to be labeled? Let's get to the bottom of it. And in the legislature, this is where we can make big change. So I do have the letter, if any of you wanted to read it from the Academy of Pediatrics, but I'm sure there's the Wyoming chapter. Ask them, why don't they look at this? And it's really not up to them. They're a nonprofit organization, but that they're the ones pushing it from a national level even. We also have, we talked a little bit about the autopsy bill and making sure that the wording in there with therapeutic levels would be included. I know with our bill, it speaks to medical examiners and they have to test and record the psychotropic drugs of the deceased. And they also have to, anybody who committed a mass shooting, and they would have to report that. But they also extended it to, they also have to be researched. The drugs have to be researched so that they can get data back. So they're actually holding some people accountable at this point. But again, don't just ask for research, ask for specific research. Do these drugs interact? Again, we know some of them do because the warnings are written in here. If you read further, not just that black box, they talk about different drug interactions. That's what we need to find out instead of expanding school-based health clinics where they're removing the parent and making it very convenient that your child can be completely, medically taken care of at school. Why are we increasing these? Let the teachers be teachers. If anything, give another recess. Get them out. Let them see nature. Let them play. Instead, it's so quick to label. We don't need more labeling. We need more exercise. We need change of food. We need healthy habits, not money thrown to the mental health industry, and definitely hold them accountable. So and we also have another bill that is going to be running too about the reporting. So if there is an adverse event, then the doctor, it is the doctor's responsibility to report, which is not current. So that would be another solution that would hopefully get people paying attention. But I will say on the flip side of that, having doctors report, sometimes they're threatened that their licenses will be removed or that will be career suicide. So we need to empower these people and protect them. If they are going to speak out with truth, they need to be able to remove the conflicts of interest. And thank you for having me, and any questions are welcome.
Yeah, Ms. Miller,
Yes.
so I've had an opportunity to read your bio. My committee has not.
Oh, okay.
But I would hope that you'd be willing to just kind of touch on some of your involvement at a national level and where you left off in your last position and where America is headed. Wyoming, obviously, we're on board with keeping our people healthy.
Yeah.
And I can tell you this committee is very motivated to really take a look at what's happening in Wyoming and delve deeper and look for solutions. So if you can touch on that, that would be great.
Okay. So I said in the beginning, I've done legislative work for 11 years. I was a mama bear that started in the beginning and kind of got catapulted and just found my way. And the two issues that I speak to are vaccine injury, vaccine exemptions, and as well as this topic of psychotropic drugs. My last job that ended with the two-year initiative in December was Reform Pharma, and that was with Children's Health Defense. That is where we expose corruption from Big Pharma, and we also tried to restore healthcare integrity. So as we dove further into untangling the corruption at such a deep level and the things that are being bought off or manipulated, different things like that, it's very alarming. And even in our, what we call ruby red state, we saw a lot of the corruption still happening. And that's where, I guess, taking me before this last job, I was, on a mission to make change and not have legislation, prevent families from fostering because they use a vaccine exemption. And we changed the laws for that. We changed the laws for, this year, psychotropic drugs. What are we doing? We also dove into the school-based health clinics. So we would interview, a lot of experts, even whistleblowers in the pharmaceutical world, as well as psychiatrists. We just dove into a lot of this information. And now that I'm super excited that Secretary Kennedy is in his space, I think we're going to see real truth come out. I had the opportunity and the honor of helping alongside work on his book, The Wuhan Cover-Up. And that was something that really even opened my eyes, putting all the information together and just seeing how planned the corruption is. And I think that's what, we acknowledge it, but we don't stay in that space. We go forward with solutions. What is the solution? We know that industry is corrupt. We know that there's conflicts of interest, but what can we do? And really where it is, in order to reform pharma, it's with the people. It's not with the industry. It's one person at a time being educated and changing the minds to see that there really is truth. There are other ways to get off of these drugs. There are other ways to stay healthy. You can control what goes into your body. You can control what's sprayed on the weeds. There's a lot of stuff we don't have control of, but it's almost like, go back to our Constitution. We need to be self-governed citizens. That's where it starts. And that's what we've seen really just tenfold increase recently. People are excited. They want solutions, and that's where we're headed. And I'm thrilled that he's the new secretary. He has stuff to reveal.
Thank you.
Thank you. Thank you for asking.
Yeah. Okay, committee, any questions of Ms. Miller? Representative Wasserberger.
Thank you, Madam Chair. Thank you, Ms. Miller. I was just wondering, I remember several years ago, there was, one of my friends was going to the doctors and he was telling me, he's like, oh yeah, they're giving me, some medications to try. I didn't have to pay anything for them. They were all free. And then later on, he told me he realized that they were subsidized. Do you know if that's something that happens at the state level or the federal level with the subsidization?
I have a
Miller.
friend, I'm sorry, thank you. I have a friend who would know more about that than me. I don't get into that so much on that side, but I'm aware of it. But yes, there's different things, especially in the pharmacy world, the different promotions of different products. And they do clawbacks, they do incentives, things like that. But I don't dive into the specifics of it, but I could probably connect you with people who do.
Vice Chair Ottman.
Thank you, Madam Chairman. Ms. Miller, from observation place, I watch children that, especially little boys, who are very, very active, and educators that say, I just can't handle this classroom with them doing that. And so they would talk with the parents and be prescribed something, but I never, it's like, okay, what drug are you on? What drug are you on? It depends on their physician. But then there was never follow-up. It was like, come back if you're having problems. And so that seemed to me, I mean, the drastic change in that child. And then you were talking about coming down off of that. There wasn't the follow-up. So is there a way to address that through, I don't know what?
I think that comes with the tapering off plan. I think that's where you have to work with the physician on that. Again, going back to let teachers be teachers. Teachers can say, hey, this is what we noticed in the classroom. It is not their job to get them prescribed something because of their issue. And you have to think about the parents too. The parents, they could be, just, this is the last straw. They told me my son did this or my daughter did this. I need something now. And then it's just like immediately prescribed. That all needs to be taken into consideration and let the professionals do what they do. Teachers teach, and that is they notice though. They know your kid comes to school every day. They notice different behaviors, but they're also noticing that once the kids are drugged, they just go blank. And it may be easier for the moment, but is it better in the long run? Those are the questions. And again, school-based health centers or clinics or it's like fast paced that they want to open these up. I know our mental health commissioner just said, our desire is one in every single school. What's between you and the doctor or the teacher or whoever they put in that position? It's a hallway. That's it. So that stuff, leave it to the professionals to figure out what that is. But again, holding them accountable. Accountability is I feel like so few. I'm just trying to rack my brain of all the things that I've worked on in different ways. And, the Department of Children's Services is another area where that is rampant. That's one of our highest costs. So that would be another thing that I could share with you is what is the cost of the state of these drugs with children who are in state custody? And why, and what is their accountability? Because we don't have much. They say that their outcomes are great, but they never speak to, they will say some stuff of, reduce principal offices. But if you're, losing your child and it's becoming numb, are they becoming robots? I'm just saying off of experience, but
Additional questions?
yeah.
Representative Clausen.
Thank you, Madam Chair, and thank you, Ms. Miller. You had mentioned ending vaccines, all vaccines.
No, I didn't mention ending vaccines. If a child, this specific bill that I was talking about was if a family who wants to foster or adopt a child had a vaccine exemption, our state said, no, you cannot do that. They wanted the adults to be vaccinated for the flu and the pertussis. So we changed that where you no longer have to have that. You can have an exemption and foster a child who needs a loving home.
Thank
That's
you
it.
for the clarification.
Additional questions? Representative Wasserberger.
Thank you, Madam Chair. Thank you, Ms. Miller. I'm just curious, are you familiar with, do you know what's the most commonly prescribed medication that's given to children amongst schools on either a national level or one of the states that you've worked in?
Ms. Miller.
I did. I don't think I brought the data with me. I can't remember. Do you know?
We will, committee, we will
Yeah.
hear information on Wyoming data next Wednesday. So that might help answer your questions then.
Yeah, we have a whole list, the same that you'll be fed.
Additional questions, Representative McCann.
Probably more of a comment. I think the solution is going to be multifactorial, okay? We didn't seem to have these problems when I was a kid. So what changed between back then and now, which is probably the drugs? And, we've heard in testimony over this last month that, especially in the education system, well, we need to treat each kid individually. But this is a classic example that we don't. We try to put them all in a box. And then if they aren't in that box, we give them Ritalin.
You're labeled. Oh,
So that's, that's a big heartburn for me to not sit up here and bite back at the education system. But I wish I could remember her name, Dr. Kelly. She was a psychiatrist in the Northeast, very well regarded. And, she was a just gave prescriptions out. And then she just had a change of heart and said, what am I doing? And she prescribes no medicines now. And she actually, and she was a pariah. She was blackballed by the rest of the community once she turned. And she gets all the problem patients now, and she's doing really well. I wish I could remember her name so I could throw that out at you. So
Ms. Miller.
are you talking about Kelly Brogan by chance?
that is the name.
Yeah, and that, you said that it was a multifaceted approach. It is, and it is protecting the doctors who speak out. Because she was blackballed, and several other doctors have been blackballed for various medical freedom issues. And that is something that's real, and they are attacked. And that needs to be stopped.
Committee, any additional questions? Representative Wasserberger.
Thank you, Madam Chair, and thank you again, Ms. Miller. This might be another question for next week, but I'm just wondering, you're starting to see a lot more, it's becoming a lot more common where you have young kids that are choosing to transition. I'm just wondering if you guys found any correlation between that and pharmaceutical medication, or have you not seen a significant correlation?
I'm trying to think if
Ms. Miller or Ms. Matthews Gallo, either? If you have the answer.
I haven't really dug down that rabbit hole yet. I'm not trying to avoid the question. I'm just trying to think. I know there's opinions in the vaccine world on that too. But as far as psychotropic drugs, I don't know.
I would say that in Tennessee, Audrey Hale was transitioning, and Vanderbilt Hospital was implicated, and there was a big focus on that. And the psychiatric drug file number 36 is being withheld as of today. So the combination of the drugs are definitely something to look into, because you're talking about hormone drugs and then you're talking about mind-altering drugs. So the combination clearly has to be a powerful outer experience that is not natural. So I appreciate your question, and I believe that there's other mass killers that have been. So there is more than one, and it should be focused on.
Thank you. So Ms. Miller, you stated something that really caught my attention. You talked about restoring healthcare integrity. If you can wave a magic wand and restore healthcare integrity in every state across this nation, what would be some of the top 2 or 3 issues that you would wish for or ask states to address first when it comes to, I guess specifically our youth, our future generation?
So that's a large topic, and my personal opinion with that is, I would say 3 things. Restoring healthcare integrity, thinking about the self-governing person, but as a whole, for the state, for the public. I would say the mental health industry needs to be drawn back and really held accountable and look at things instead of just handing out pills like candy. They are real issues. We're not saying that people don't have issues, but I think one of the psychologists that I like, he says it well, the fact of grieving and experiencing emotion has basically been taken away. People don't even know how to do that anymore. So that whole issue of mental health and knowing that there's so much money going after it, I would say a very hard look at the vaccine schedule. The adverse events are traumatic. It is costing the states billions of dollars because of the vaccine injured and the lack of help that they have. I would also say the farms, the food. I think food, off of my own journey, I switched my food years ago before it was cool. And I can tell you that, one, I didn't know how sick I was. The feeling that I had when I changed my food was life-changing. I had chronic headaches, migraines. I just didn't feel well, and that changed my life. So those are three things, and between the pesticides, the growing of fake food, processed food, that really does have an effect. And that's something that, can go back and link to mental health. Look at the food dyes, look at the sugar. Look how much sugar is introduced to children. And again, personal experience from all of these. I didn't allow my kid to have all the sugary treats in school. And I counted one day, she was offered sugar 9 times. And we homeschool, but her first few years, we went to a small private school, and she was still offered 9 different times sugar. And they didn't even have a cafeteria. So those are my 3 personal choices of what to dive into.
Okay. Representative Gugemaz.
Thank you, Madam Chair. Thank you both for being here. This is really great to have you.
Thank you.
I echo what you just said, especially on the food. We had an personal instance with our son who had cancer, and we were at the hospital, okay? And we couldn't believe what was on the menu.
Yep.
Here he is trying to overcome leukemia, and they're offering all kinds of carbs and sugars.
Yep.
And we're like, how do you expect people to get healthy? But on another aspect that I wanted to address is I explained, get this, I explained to the doctor how the body works. Okay, how it intakes, how we give our body the building blocks based on what we eat and don't eat, and what our body does with that. So he disagreed with me he's like, oh, I disagree with you on most of what you just said. So my feeling here is we got a huge problem because the doctors are the ones that are prescribing these things. Nothing against the doctors, because they are taught to do this.
Yes.
And they believe 100% that this is the right thing to do because that's in the education that they get. It's baked into the cake, as it were. So we got a big hurdle because basically we would have to revamp the education of our medical industry.
Ms. Miller.
I would like to respond with that by saying asking one question. Who sponsors the medical schools? And there you have it.
Further questions? Representative McCann.
Just another comment, who sponsors the studies too? Need to really, that's the first question I ask, is who's sponsoring the study?
Yep.
As an MLPA by trade, but I'm an ortho guy, so it's just advanced carpentry skills, so I don't mess with all this very often, but I do recognize that it's a problem. Big Pharma has definitely got their tentacles everywhere. Has there been any the military, I was a military guy, so a lot of my friends have done some of this alternative medicine, ayahuasca and stuff. Has any of that been tried in kids? I'm just asking. Because there seems to be really good success with it on that side. But you're talking about a pediatric brain versus an adult brain, two different things. So I'm just curious.
I can't speak to that.
Ms. Gallo?
I would say, first of all, back with the children and informed consent. Most of these children aren't being told that once they're on these psychiatric drugs, they really can't join the military. And that's frightening as a national security issue. And then as far as the children go, the education, if you look at the checklist of the child with ADHD, it mirrors that of the gifted child. Okay, so if we as a country start embracing these children not as looking for a solution to a disease that they don't have, but rather support them like President Eisenhower did, and that's why we named our organization Able Child. It was based on his grants of supporting children to learn math, science, and alternatives to make us the strong country that we are. And you had mentioned that we should compare ourselves not only internally in the United States, but to other countries. When 1 in 4 Americans are on psychiatric drugs, and we are letting the pharmaceutical industry and the psychiatric industry diagnose our population, we are in critical mass right now. The Association of School Psychology operates in every school, and they are an industry that are unchecked. They are in the hands of pharma. It is a monopoly. My organization is not allowed in public schools. We can't get the same access to the parents. They're a captive audience. So we need to break that monopoly up. The Association of School Psychology has to be terminated from our public school systems. And I know that sounds radical, but they're the ones that are responsible for diagnosing these children. And the children have absolutely no right to say when they're 7, 8, 9, 10, this is not what I want. And the parents are being given information that is slanted and lies. So how we combat that is what you guys have done here today. Do you know how difficult it has been for my organization to be heard by lawmakers? I'm shut down when I go to the behavioral health oversight committees, and they cut my mic off. Before I came here, I asked the chairman, how much time do I have? I am so grateful for your attention on this national crisis. It has put our country at such risk, militarily, everywhere, because our children are not prepared for what is coming our way. And it's because they do not know how to think any longer. They are told that they suffer from mental disorders in which they do not have, and their liberties are taken away. Their futures are at risk. So I am so delighted to have crossed the country to come here. And I look, one other thing I do want to say that I did miss out on is that your public health department, they separate deaths, and they're using the World Health Organization's definition of a violent death. And this is according to your own documents, and I do want to leave this with you because having had a family member that committed suicide myself, I could tell you that it is such a human rights violation to use their data, their death as a suicide death, to further fund the mental health industry that is completely unaccountable. My brother-in-law's death, the psychiatrist wasn't held accountable, but I could tell you they used his number in the state of Connecticut to try to get more money. That's a human rights violation. So we're in a crisis, a mental health crisis. And you guys, for me, Wyoming, what a beautiful state. I have to tell you, I am so honored to be here and that you took the time to listen. And, whether you agree or disagree, you let us speak to the data that we need. So thank you very much.
All right. Well, ladies, if there's any last words that you'd like to have.
I would just like to jump on the end of that and say really thank you. We held a meeting, I think we're a little bit different how we operate, but we held a private meeting where all the legislators were invited, and we had some experts in and talked about this issue and how the need and importance of bringing this before the state. And I can tell you that the people who knew about this issue, their jaws dropped because of how much more information that they learned from this meeting. So another step for you guys is to invite the other people and let them get educated, because even if you're sensitive to the issue, which I think we all are, I think we're all, there's not a one fix, as you pointed to, but I think it's time where other people need to hear whatever side you're on, there is data that cannot be dismissed. And there's also lack of accountability that can't be dismissed. So I really, really do appreciate you inviting us out here for us to speak, you truly listening, asking great questions. That's the beginning of true reform. That's where we can get answers and solutions and really help people. And that's, if we can save another kid, that's been my mission since my daughter was born. So keep doing what you're doing. I appreciate it.
Thank you both for joining us this morning. We appreciate your insight and listening to your experiences and helping us see different perspectives on behalf of the issues that we take on. So thank you very much for joining us.
Thank you.
And enjoy your stay in Wyoming. So Representative Wasserberger.
Sorry, and thank you, Madam Chair. So you said they're going to be here next week, and are we able to get your contact information? Will that be available?
We're here for the rest of the day. We'd happy to meet with each one of you individually. Even though we're far, we're a phone call away, and we will be supportive in any way possible.
All right, well, thank you. And committee, thank you for being here this morning, and our meeting's adjourned.